Back on Wednesday's show, Dr. Deepak Sharma with us once again from Premier Urgent Care. And Dr. Sharma, welcome back to the show. Glad to have you again.
Thanks, Mark.
So you've been open for a couple of months now. You're in a great location next door to Chick-fil-A on Jackson Street. How's it going?
I think it's doing well. We've had some great feedback from patients, and that's the most important part that we strive for, and we've been blessed so far.
What type of injuries and illnesses are you seeing?
Well, like I mentioned before, we see all minor conditions. Anything that's not life-threatening, we can see them, and we can rapidly triage those conditions. If we ever do feel there is a need for these patients to go to the emergency room, we promptly do that, and sometimes even get them admitted bypassing the ED.
But you are you're specialized in emergency care?
That's correct.
And let's talk about your staff. You have nurse practitioners there that have been in that type of situation as well?
That is correct. We have hand-selected group of folks. So we have at least 2 nurse practitioners that I've known for over 15 years. For the nurses, they became nurse practitioners. I was somewhat involved in the training during the nurse practitioner years, and then as nurse practitioners, they worked with me. So I've known them well and feel like they represent me well when I'm not there.
And I understand my aunt went in and she loves the care she receives there. It's probably been a couple of times. But it's good to hear.
Yeah.
Tell us, is the flu gone or is it still here?
Flu is by and large gone around this time of the year. We do see occasional viral symptoms that mimic flu, but the testing that we have performed on these patients has so far been negative. So there is an ailment that mimics flu-like symptoms. However, I believe this is not from the flu virus.
And you recently received some certification, right, from the Urgent Care Association of America. Tell us about that a little bit.
Well, Mark, as you know, urgent cares, walk-in clinics is a new form of healthcare delivery. It's adding convenience. So the concept of patient waiting for the visit is changing from the doctors waiting on patients.
Right.
With that in mind, a lot of centers are opening up. As you know, walk-in clinics are all over, and each clinic has its own capabilities. So as a patient, when you approach a clinic, there is a sense of insecurity not knowing what the services that clinic provides.
Mm-hmm.
So Urgent Care Association of America, which is the largest, one of the largest organizations for urgent cares in our country, has devised a certification system where strict, nationally standardized criteria is used to certify a particular clinic, whether that qualifies as being an urgent care. And a lot of elements are taken into consideration, and that's fairly extensive list over here, but primarily the population that you cater to, the age groups you cater to. So you have to cater to pediatrics through geriatric age group, which we do. You have to provide certain services like the ability to give oral, intramuscular, intravenous medications, intravenous fluids. We have providers that are capable of reading EKGs, interpret cardiac monitoring, be able to do cardiac testing, have an extensive in-house X-ray ability. A lot of these criteria have to be met for a center to be certified. Besides this, obviously have a strong physician oversight in the whole program, and be able to have personnel and equipment. If God forbid someone collapses, that you should be able to resuscitate them. So have ability to provide advanced airway support, have a well-functioning defibrillator on board. So there are a lot of criteria that have to be met.
We have all those capabilities.
We do.
And that's wonderful, I guess, hence the name Premier. But it's also convenient. And I think folks love the convenience.
Absolutely. And just to give you an idea about the certification, how stringent this is, just in Louisiana itself, we have over 300 clinics that are walk-in, and a little over 30 are the ones that are certified. So,
Quite an honor then.
well, we're blessed, and we obviously take pride in that, and it's congruent to our vision of patient-centered care.
And thank you for bringing us to Central Louisiana.
Thanks for stopping by, Dr. Sharma. Appreciate it.
Thank you.
More to come on GooddayCenla, so stay right here on CBS.